Good afternoon, everybody. I am here to help people who want to take in charge of their health. I remain CC, natural therapy, so I'm here again to treat pelvic inflammatory disease. So are you having challenges of PID? Have you been having issues? You go to scan, you go to the diagnosis center and you're being diagnosed of pelvic inflammatory disease, or you're being told that you cannot take in because your fallopian tubes are blocked because it's associated to PID. Okay, listen so clear, because I think you'll be doing it from your home. So your hygiene is needed, but at the same time, listen and know the cause and know that it's treatable for those who have lost interest in fertility or have lost interest in having their own children, rather thinking of surrogacy or trying to do adoption and the rest of it. Here is an information that will help you clear yourself, and then you are in charge, knowing fully well that you're uniquely created. So I want to inform you what PID stands for and what it is, the symptoms there, and a little thing or tips you have to do. Don't mind you today that it's just treatment of 3 days. So if you're interested in treating it for 3 days, you can still call us, you can still chat, you can still ask your questions, we'll book you and clear that from your home. Okay, let's look at it again. So PID is pelvic inflammatory disease, which is bacterial infection that affects the female reproductive organ. It is not something you can clear from your kitchen or home. It's a medical condition that requires treatment from a healthcare professional. So, but then we are here to give you some ideas or give you some medications or try to clear it from home, in the sense that those pharmacy stores around you, we can prescribe drugs that can help you clear yourself and you become fine. Okay, but before then, you must diagnose yourself, send your results to us, and we'll help you clear the remaining PID that has been found there. Again, another thing that you have to do for us is, as you're doing your scan, you're doing your urinary tract infection, you're checking chlamydia because it's associated to it, you're doing VDRL as well for us to know your state, so that we'll be able to help you clear all this. So sit down and listen. Okay, so PID is nothing else but bacterial infection that affects women reproductive organ, as we said. So PID is bacterial infection that affects the uterus, the fallopian tubes, and ovaries. It's usually caused by sexually transmitted bacteria such as chlamydia and gonorrhea, as we've said. Okay, so symptoms of PID includes lower abdominal pain, some feverish states that you might be having, unusual vaginal discharge, okay, painful urination, and so on and so forth. So another one is your menstruation, a delayed menstruation. It can cause it. It can cause fluid that is higher. It can prolong your menstruation to 10-14 days. So PID has that ability. It can actually prolong your menstruation to a month. So that is the effect of pelvic inflammatory disease. But know it today that you can clear it and get healthy for yourself and become happy and have your children. So all the PID patients around, anybody that has told you of PID issues, so mind you today that it's treatable. It's not more than 3 to 7 days. It's not more than 3 days. It's not more than 3 to 5 days. So key in, depending on your situation, key into what we are giving you as an advice. So how to prevent PID? Practice safe sex. Hello, practice safe sex. As I said, wear your condom, make sure you maintain your sex partner, maintain your husband, and not to try the other parts. Try from left, or try Mr. A and Mr. Z to know which one will help you conceive. As you're doing that, you're adding more to the pains the PID must have caused to the epithelial tissues of the uterus, the part of the body, the pelvic, and the rest of it. Please be in a place so that it will help us. Get tested with your regular testing for STD. Do it, especially if you have multiple sex partner, and try everything possible to live right and stop it. Get vaccinated. Get vaccinated against human papilloma virus, HPV, and hepatitis B as well. It will help you maintain good hygiene. Keep your genital area clean and avoid sharing personal hygiene items. I talked about your hygiene as the key thing when I started talking. So you must mind your hygiene when we're talking of clearing PID. How to treat PID? PID requires medical attention. Your health care providers may prescribe antibiotics to treat the infection. If it's severe, it can cause hospitalization and may be necessary. Please, if you are suspecting you have PID or experiencing symptoms, consult your healthcare. Try to get yourself diagnosed. Don't say because I have not taken it, could be I'm having PID because you're hearing this. Please, but just know that it's treatable. Your antibiotics can help you clear yourself, but you need a health professional. We are there as well to help you clear those from your system. Your fallopian tubes will remain healthy, your uterus will remain healthy, and you'll take in again. As you're doing this, you're dancing your dance and smiling in under your testimonies, and we are dancing dancing the same dance for you and smiling alongside, because we want to get your charted testimonies. Thank you as you're here. Thank you as you're about to practice what we're doing, as you're about to be in charge of your health. We remain CC Natural Therapy. Thank you as you sit and listen to our topics.